Good day. My name is Dr. Richard Boothby. I am the Director of Gynecologic Oncology here at Sarasota Memorial Hospital.
Welcome, Dr. Boothby. What is the leading cause of cervical cancer?
The leading cause of cervical cancer is human papillomavirus. This virus is an infection that is picked up when a woman has sexual intercourse. It can be transmitted at any time and is something that is usually the infection is picked up, but is usually cleared by the patient, and most patients that get infected by HPV do not get cervical cancer.
And who is most likely to get cervical cancer?
60% of the patients that we see that have cervical cancer are those that have not had adequate screening. Either they've never had a pap smear or they have gone more than 5 years without a pap smear. The other 40% are people who either fall through the cracks somehow or just have not followed up like their doctors have asked them to.
So how could I avoid getting HPV and prevent cervical cancer?
Well, there's several ways to avoid HPV. The best way that we have available to us now is being vaccinated, and we recommend vaccinations to both boys and girls from the ages of 9 to 26. Most of our population is over 26, and so the HPV vaccine is not effective in that age group. The other way to avoid HPV is avoid sexual intercourse, and that's usually not possible for most folks unless you're completely celibate. So there's no other way to avoid getting HPV. There's no medicines that we can give patients to avoid it, and there's no other methods of birth control or anything that avoid an infection with HPV.
Who should get a pap smear, and where can I go to get one, and how often should I get one?
Pap smears should be started when a woman is age 21. And from age 21 to 30, if her pap smears are normal, then she can have a pap smear every 3 years. And that can be done either in a doctor's office, such as a gynecologist or a primary care physician, by the physician themselves or their nurse extenders. Or it can be given, pap smears can be obtained at the health department here in Sarasota County.
Oh, great. So how does the HPV vaccine work, and is it safe?
The HPV vaccine has now been given to several million people worldwide. It is a very safe vaccine and very, very effective. Side effects of the vaccine, the most common things are a flu-like syndrome for the days after the vaccine is given, or some site irritation or induration where the vaccine is given. But it's a very safe vaccine and it's very effective. It prevents 98+% of cases of HPV-related illnesses. That includes cervical cancer, but it also includes genital warts that can be very common in young women and men, and it can prevent those things. The most common vaccine now given is what's called a 9-valent. That covers 9 different subtypes of the HPV virus, and that's the one that is recommended now by the CDC to be given to, again, boys and girls from ages 9 to 26. We recommend early age vaccination, usually around 11 or 12, when the patient's immune system is most active, and so a vaccination given to a boy or girl at 11 or 12 has a much more activity than one given, say, at age 25, 26.
Very interesting. So you pretty much covered this, but just to reiterate, who should get the HPV vaccine?
The HPV vaccine should be given, again, both to boys and girls. Boys are the vectors, but they can also get HPV-related cancers and genital warts. They can spread the vaccine to their female partners and to their male partners if they're homosexual. They can also, the age group is usually 11 to 12 is the best range to give the vaccine, because they're getting vaccines for other things at that point in time. And again, their immune systems work the best when the vaccine is given early. And also at that age, most of those children are not sexually active, and it's much better to give the vaccine before the onset of sexual activity, so we are giving it to people who have not been exposed to HPV.
Oh, very good information. I'm nervous about my daughter getting the HPV vaccine. Who should I talk to for more information about this?
Well, there's several sources that you can talk to for your son or daughter. The HPV vaccine studies show that it does not increase sexual activity in boys or girls that are given the vaccine. It's also a very safe vaccine, but information can be obtained from your pediatrician's office and also from the mom's gynecologist's office. Should have all the information they need for the HPV vaccine, and also the health department has the information on the HPV vaccine.
Thank you. Is there anything else you'd like to cover?
The only other thing I'd like to add is the patients that I see that get cervical cancer are usually moms who are busy in their late 20s, early 30s having children, and they neglect their own health care. And so they go from usually age 30 to 40, 45 without seeing their doctor, without doing a pap smear, and in that 10 to 15 year time period they can develop cervical cancer. So I stress to them, it is important to take care of your family, but also take care of yourselves, and because this is a perfectly preventable type of cancer if you follow up and do screening with pap smears.
Thank you so much.
You're very welcome.